My name is Gwyn Williams, and I'm going to be telling you about OpenEyes, just going through some of the modules which you might find interesting and useful. So this, as before, is a mock patient, and I'll just show some things, in particular the consent form, because it does make consenting easier. I'll click here, this is the cursor here, I'll click Add Event, and let's do Operation Booking. Cataract operation. That's what they're having done. So, both eyes, cataract. We added that diagnosis earlier. Procedures. Well, let's do a cataract extraction. That seems logical, I guess. Let's do the left eye. Left eye is good. Then we proceed down. Consultant required? No. Senior fellow? No. Any other doctor? Let's say no. Anesthetic? A local anaesthetic, a sub-Tenons, that's the only safe way really. Does the patient require pre-op assessment? Let's say no. And a chest anaesthetic choice is my requirement. Patient needs to stop medication, just for argument's sake. Let's say yes. Let's put stop clopidogrel. Now, there's no need really to stop clopidogrel, but let's say we put that down just to show how it works. No need to stay afterwards. The site is an example, but I imagine it'll say Swansea afterwards. Let's say urgent. Why not? Admission discussed with patient. That's true. Add comments. Not really. And there's no preference as to when the patient wants to come in, morning or afternoon. So let's save that and schedule it later. Wonderful. So now that we've done that, we can do a consent form. Add event. Consent form. Here we go. So let's click here. A left phacoemulsification. I was playing with the system earlier, that's why there are two left phacoemulsifications, in case you're wondering how strange that looks. Create consent form. What I essentially want to demonstrate is that the fields populate automatically. And you see, I've selected nothing. It's all come up. And if you wanted to personalize this, you could do it yourself by adding in some things which will then, whenever you log in yourself, be specific to yourself. Consultant, let's put Williams. That's me. Now I am neither Mr. Gideon Williams or, interestingly, a Mr. Sandra Williams. But let's click on Gideon Williams, being as that's the only Williams that's suitable. And let's put save draft. If it was in reality, I'd save and print. And that's how easy it is to do consent forms. One final thing before the end of this mini video on consenting. If you press add event, consent form, and then again, say you're doing a focal laser, unbooked procedures, create consent form, and then you can choose anything. And without having to fill out all those forms and put in laboriously the pros and cons, let's say, or have pre-printed forms, in which case you'd have in this case about 15, let's say macular grid. Not that people in the modern world should be doing macular grid really. It's not good according to DRCNet studies, but anyway, it populates automatically. Again, you can put your own thing down. Let's put Williams again. Stick with Mr. Gideon Williams. And then we've given an information leaflet, let's say that, and say they're Bengali, so they need an interpreter. And let's put Raj. Right, wonderful. So let's save that. And oh, we didn't put which eye, so let's put both eyes. Needing a macular grid, save draft. And that's the end of this mini video on consenting. Thank you. And thanks to Luke Anderson.